Hello everybody, let's discuss about the drugs in the obstetrics and gynecology. We'll discuss about the important drug that we use in the most of the cases in the obstetrics cases during the time of parturition, that is oxytocin. Oxytocin is a cyclical nonapeptide which is synthesized in the supraoptic and paraventricular nucleus of the hypothalamus, which is actually released from the posterior pituitary. So these secretions, which are actually controlled because of the positive feedback mechanism, that is initial release, and it will stimulates the production and the release of further oxytocin. So it is released at the time of the parturition, and it is also released at the time of the milk ejection when the baby is sucking the breast. So oxytocin, there is oxytocin combination drugs are also available in the market. So synthetic oxytocin will be available as a syntocin, or it is available as a pitocin. It has only got the oxytocin effect without any vasopressor action. So it is available in the ampules, which is containing of 5 international units per ml, and the other drug is sintometrin, which is a combination of 5 units of syntocin and ergometrin of 0.5 mg. And also desamino-oxytocin. It is not activated, it is not inactivated by the oxytocinase and is 550 to 100 times it is more effective than the oxytocin. It is used as a buccal tablet which is containing of 50 international units. And some oxytocins are also used in the form of the nasal solutions, which is containing of 40 units per ml. So oxytocin loses its effect unless it is preserved at the correct temperature. So it is always stored in the temperature between 2 degrees to 8 degrees centigrade. What is its mechanism of action and how long does it act, how it acts inside our body? Let's discuss. So its action is noted at approximately in 1 minute of time. So as soon as you give, its action will be there for around 3 to 4 minutes. So it will act duration of action of approximately 20 minutes. Plasma steady state is reached in 40 minutes, and it gets metabolized and degraded by the oxytocinase enzyme. And when given as a bolus, you should be very careful that it is going to cause a profound hypotension. Uterine responses to this oxytocin, and it will increase from 20 to 30 weeks of gestation and rises rapidly at the term. So during the early stages of the labor, the uterus will not respond to the oxytocin action, but in the later stages, like around 20 weeks or during the 5th month and 6th month onwards, slowly the oxytocin receptors will keep increasing in the uterus. So by the term, the oxytocin receptors will be more, and it's when the uterus starts its contractions, it gives the positive feedback mechanism, and the hypothalamus, the supraoptic and the paraventricular nucleus will respond, and it will give the oxytocin through the posterior pituitary, and it helps to act this oxytocin on the oxytocin receptors which are present in the uterus, and it will help in the uterine contractions and also for the baby delivery. So how it's gonna be used is for the ripening of the cervix, and also during the time of the induction of labor, and also for the augmentation of the labor. So the active management of the third stage of labor, it is used. What is the active management of the third stage of labor? One is delay in the cord clamping. Some indications, some contraindications are there in the delayed clamping. We have to know what are the contraindications for the delayed cord clamping. So we should be very careful in which cases we have to do early cord clamping, in which cases we have to do the delayed cord clamping. So in the active management of the third stage of the labor includes delayed cord clamping, uh, control cord traction, and also administration of oxytocin. So uterine massage was there previously, but now it is not considered as a active management of the third stage of labor. So the oxytocin is included in the active management of the third stage of the labor for the prevention and treatment of PPH. During the time of puerperium, the oxytocin is used to minimize the blood loss and also to control the postpartum hemorrhage. It is used to accelerate the abortions inevitable or missed, and to expedite the expulsions of the hydatiform mole to stop bleeding soon after following the evacuation of the uterus. It is used as an adjunct to induction of the abortions along with the other abortifacient agents like prostaglandin E1 and prostaglandin E2, which includes misoprostol and dinoprostol gels. So for the need of diagnostic procedures, like we'll go for CSTs and oxytocin challenge test. And also the oxytocin is used in case of milk ejection. What are the contraindication of oxytocin? When you are not supposed to give the oxytocin. We have learned when we have to give the oxytocin: at the time of the labor, at the time of missed abortions, at the time of inevitable abortions, at the time of hydatiform moles and all. But now we'll learn what are the contraindications of the oxytocin. So whenever we find that pelvis is not adequate and you don't have to stimulate the uterus for the baby to be pushed downwards. So in cases of the contracted pelvis, then you don't have to give the oxytocin. And if it is also a scarred uterus, previously a scarred uterus, when you're trying for the VBAC and all, you don't have to stimulate the uterus. If it will more cause the uterine rupture. So better to avoid oxytocin at this time. And also in cases of a malpresentation, when you know the baby will not come down, then you don't have to give the oxytocin. And fetal distress, the baby heartbeat is either it is going to a tachycardia or it is going to the bradycardia. You need to be very cautious before you give the oxytocin. Better check a fetal cardiac activity and then give it. And also in cases of the grand multipara, because their uterus will be much more thinned out, so we have to be very careful when you're giving an oxytocin. And also in cases of the cardiac diseases, because sometimes unknowingly if somebody is going to give the oxytocin um, in IV bolus, then it is going to cause certain hypotension. What are the risks with this oxytocin? There is a maternal risk and there is a fetal risk. So, in case of a maternal risk, uterine hyperstimulation will happen. So, we need to know what is a normal contraction rate when, like, it is like in 10 minutes of time, at least 3 to 4 contractions lasting for 45 to 55 seconds in 10 minutes of time. This is a good uterine contraction. If it is more than 5 uterine contraction, then we have to consider that as a tachysystole. So you should be very cautious that if she is getting a good contractions, then you don't have to give oxytocin, because it will cause uterine hyperstimulation. Because of this, it will cause thinned out of the uterus and later it results in the uterine rupture. And also we should know about this water intoxication. So why there is a water intoxication? From the posterior pituitary, from the hypothalamus, we know that there are only two hormones that are going to release. One is oxytocin, the another is ADH hormone. So indirectly it will also act on the ADH hormone. So due to this effect, it causes an antidiuretic function when it is used in the higher doses, not in the normal dose, but in the higher doses, that is around 30 to 40 milli international units per minute. So it is actually manifest, the patient will have the hyponatremia, the confusion, coma, convulsions, congestive cardiac failure, and death. It is prevented by the strict fluid intake and output record. Use of We need to use the crystalloids and by avoiding the high doses of oxytocin for a long time. And also we should be knowing that it should never be given in the IV bolus because it is going to cause an hypotension, especially in the patient who are having a cardiac diseases, and also the patients who are already having the hypovolemia. You don't have to give oxytocin in the IV bolus. And also in patients, it will cause the anginal pain, and also sometimes it results in the tachycardia or sometimes it results in the bradycardia. In cases of the fetal risk, it causes a fetal distress. So, and also the fetal hypoxia and even fetal death. So, every time whenever you are keeping the oxytocin drip to the mother in the active stage of the labor, should be very cautious in recording the fluid chart, the oxytocin drip rate, the input output charting, as well as the mother's vitals, and also the uterine contractions. At the same time, you have to monitor the fetal heartbeats. So induction or acceleration. There are actually so many different protocols are present in which we have two regimens. One is a low dose regimen, the other one is a high dose regimen. In the low dose regimen, we will use 1 to 2 international units per minute. Slowly, we will keep increasing 1 to 2 international units per minute every 30 minutes. We will keep increasing to the maximum of 32 international units per minute according to RCOG it is. According to ACOG, we can increase till 42 international units per minute. This is low dose regimen. But every time you have to monitor the uterine contractions. That is very important. Next thing is high dose regimen. So starting itself, we will start with the 4 to 6 international units per minute with the increment of 4 to 6 international unit per minute every 30 minutes, and maximum we can reach up to 32 international units per minute. You can go to the high dose regimen like till 92 international units per minute in some trials. But this is used only if there is no uterine contractions are there and you wanted at least like very minimal, like one contraction is there, then you can try for the augmentation of the labor. So this is low dose regimen where you are starting with a very low dose, that is of 0.5 to 1.5, and you are going to increase every time to 1 to 2 international units per every 30 minutes, and you can reach up to 40 to 42. Okay. Whereas in high dose regimen, you are starting with 4 to 6 international units, and you keep increasing the same like 4 to 6 international units every half an hourly, and you keep recording the uterine contractions at the same time and also the baby's heartbeat. And based on the need of this oxytocin, you can increase up to 90 international units. So, whenever you are giving a high dose of oxytocin, you need to remember that there is a high risk of tachysystole, that is more than 5 contractions in 10 minutes. So, that's why you should be very careful of this oxytocin whenever you're keeping on a drip. Okay, and another adverse effects on mother is like hypotension, hyponatremia, arrhythmia, tachysystole. So on electrolytes, complete sodium will be going down. At the same time, the BP will go down. Sodium is, when you have more sodium, your BP will be high. If you have less sodium, your BP will go down. Remember that. And also, as the BP falls down, there is heart gets confused and it starts going into then arrhythmias, and the uterus will undergo more and more contractions and it results in more than 5 contractions, that is a tachysystole condition. Whereas in the neonatal adverse effects, you should remember that as the electrolytes are going down, the baby may have any time the seizures, and also baby will have an hyperbilirubinemia and retinal hemorrhages and fetal distress, fetal hypertension, and even fetal death. So in low dose regimen, it has a prolonged induction delivery interval with a better safety profile with few episodes of hyperstimulation. The increased induction to delivery interval may increase the chances for the fetal infection and the chorioamniosity. So whenever we keep an oxytocin, we make sure that the liquor is clear, because even if the liquor is not clear, and if the baby inside, if there is any blood stained liquor is there, or if there is any meconium stained liquor is there, we have to be very cautious in keeping the oxytocin drip. And also you have to remember to check the baby's heartbeat for 1 minute of time, and you should be sure that baby's heartbeat is good. If you find anything like a blood stained liquor, or if you find that it is a meconium stained liquor, and your obstetrician is telling you to put an oxytocin, better inform them that it is a blood stained liquor or it is a meconium stained liquor before you give. And you make sure that baby heartbeat is normal in 1 minute of time, and you tell everything to your obstetrician. At the same time, don't forget to check the mother vitals as well, and also the uterine contractions as well. Everything you tell to your obstetrician, and let your obstetrician decide about it. So we'll discuss about the carbetocin. Carbetocin, it is a heat stable analog of oxytocin, which does not require any kind of a refrigerators, but its half-life is around 85 to 100 minutes, whereas we consider the oxytocin half-life is just for 3 to 4 minutes, right? The carbetocin is much better than oxytocin, where in oxytocin it needs the refrigerators, the temperature has to be maintained. And also the mechanism of action, when you see that there is a the half-life period of the oxytocin is around 3 to 4 minutes, but here you can see that it is for 85 to 100 minutes. So you can safely use it in a grand multiparas or multiparas, multigravidas. So the elimination time, it will take around 40 minutes. So it has a longer action. The disadvantage is that it is of high cost, around 450 rupees, and it is used in cases of postpartum period after the baby is born. And the dosages, you can give it in the form of an injections, either IM or IV, 100 micrograms. Contractile effect starts within 2 minutes after administration, and it will last for about 1 hour. Its adverse effects includes nausea, vomiting, abdominal pain, itching, skin, there is an increased body temperature, there is a trembling and weakness, chest pain, dizziness, anemia, chills and sweating, and there is even a metallic taste, tachycardia, and respiratory distress. You should remember all those adverse effects before you give any kind of a medicine. Okay, even you don't remember the mechanism of action and all, it doesn't matter, but remember that it is going to act on the uterus. And also you need to particularly remember about this adverse effects. Contraindications of this carbetocin is that you cannot use it in cases of the hypertension women, and also you cannot use it in cases of the cardiovascular disease